Congenital anomalies, birth defects, causes, types, and prevention. A birth defect is an older term used to describe a problem that occurs to a fetus during pregnancy. The term congenital anomaly is more accurate. Congenital refers to something present at birth. The word anomaly is a synonym for abnormality. The term congenital anomaly is more accurate since it encompasses a variety of changes that can occur to a fetus during its development rather than during birth. Some congenital anomalies are mild and do not require treatment, while others are more serious, require treatment, and can affect a child's life in many ways. Some congenital anomalies can be detected before birth, while others may not be diagnosed until later in life. Hi, I'm Dr. Beth, and I'm a pediatrician at SickKids. It's natural to have questions and concerns about congenital anomalies, especially if you are pregnant or planning to have a baby. In this video, we will talk about what causes congenital anomalies, what are the common types of congenital anomalies, and what you can do to reduce the risk of having a baby with one. What causes congenital anomalies? Congenital anomalies can have different causes, such as genetic factors, environmental factors, or a combination of both. Sometimes the cause of a congenital anomaly is unknown. Often, there is nothing that the parents could have done to prevent it. Genetic factors. Genetic factors involve genes or chromosomes. The genes that are inherited from the parents can have changes that affect the fetus. Sometimes changes in the genes are not inherited but can occur randomly. Genes that are affected by changes in either of these manners can lead to congenital anomalies. When a condition is inherited, sometimes the baby only needs to receive a copy of an affected gene from one parent, for example, Marfan syndrome. For other conditions such as cystic fibrosis or sickle cell disease, the disease occurs if both parents pass along an affected gene. Sometimes entire chromosomes are involved. There can be too few or too many chromosomes, or there can be a problem with the structure of the chromosomes. For example, babies with Down syndrome have an extra copy of the entire 21st chromosome. Environmental factors. Environmental factors are things that the mother is exposed to during pregnancy, such as drugs, alcohol, infections, or chemicals that can harm the growth and development of the fetus. Mothers who have certain medical conditions, such as diabetes, have an increased risk of having a baby with congenital anomalies. How are congenital anomalies diagnosed? Some congenital anomalies can be diagnosed during pregnancy through screening tests or special diagnostic tests. Screening tests are blood tests or ultrasounds that can estimate the risk of having a baby with a certain congenital anomaly, such as Down syndrome or spina bifida. Diagnostic tests are more invasive tests, such as amniocentesis or chorionic villus sampling, that can confirm the diagnosis of a genetic abnormality by analyzing the baby's cells or DNA. Some congenital anomalies may not be diagnosed until after the baby is born, either through physical examination or a blood test that screens for several disorders in newborns. And some congenital anomalies may not be diagnosed until later in life when symptoms become apparent. Diagnosing a congenital anomaly can help the parents and the healthcare team discuss and plan the best treatment and care for the baby, and also provide emotional and educational support for the family. How are congenital anomalies treated? Most congenital anomalies cannot be cured, but they can be treated to improve the child's quality of life and reduce complications. Treatment depends on the type and the severity of the congenital anomaly, and it may include surgery to repair or correct the physical abnormality, such as a cleft lip or a heart defect, medications to treat infections, pain, or other conditions associated with the congenital anomaly, such as sickle cell disease, physical therapy to help the child develop motor skills, strength, and flexibility, such as for club foot or spina bifida. Devices such as hearing aids, glasses, braces, or wheelchairs to help a child with specific disabilities such as hearing loss, vision problems, or mobility issues. Educational support to help the child learn and achieve their potential, especially if they have cognitive or developmental delays such as Down syndrome or fetal alcohol syndrome. Some congenital anomalies can even be treated before a fetus is born through prenatal surgery or gene therapy. How can congenital anomalies be prevented? Some congenital anomalies cannot be prevented because they are caused by genetic or random factors that are beyond our control. However, there are some steps that can be taken to lower the chances of having a baby with a congenital anomaly, such as seeing your healthcare provider before and during pregnancy to get regular checkups, prenatal care, and screening tests, sharing details of your family's medical history with your healthcare provider to help identify specific genetic risks, taking a prenatal vitamin with folic acid every day, starting before you conceive and continuing throughout your pregnancy to prevent neural tube defects, avoiding alcohol, tobacco, and drugs, which can harm your baby's development and cause congenital anomalies, talking to your healthcare provider about any medications or supplements you are taking and making sure they are safe for pregnancy, avoiding exposure to harmful substances such as lead, pesticides, radiation, or chemicals that can affect your baby's growth and development, lowering your risk of infection by washing your hands, avoiding undercooked meat and raw eggs, and staying away from cat litter and feces, which can carry a parasite that causes toxoplasmosis, maintaining a healthy weight and managing any medical conditions you have, such as diabetes or high blood pressure, which can increase the risk of congenital anomalies, getting vaccinated to protect yourself and your baby from diseases that can cause birth defects such as rubella or chickenpox. These are some of the ways that you can have a healthy pregnancy and reduce the risk of congenital anomalies. But remember that there is no guarantee that you can prevent all congenital anomalies. Key points. Congenital anomalies are common and they can have different causes, types, and treatments. Some congenital anomalies can be diagnosed before birth, and others will not be diagnosed until after birth or later in life. Some congenital anomalies can be prevented or reduced by taking certain steps before and during pregnancy, but some are unavoidable and unpredictable. If you have any questions or concerns about congenital anomalies, talk to your healthcare provider, who can give you more information and guidance. I hope you found this video helpful. Subscribe and visit aboutkidshealth.ca for more. Thanks for watching. Stay healthy, everyone.